the Plainville Southington Health District. So we're really honored to be the first ones in the state to put on this open house in conjunction with the State Health Department. With me tonight is Deputy Commissioner Kathy Lewis. So thank you, Kathy. Thank DPH staff for all coming down here. What we're going to do is just go through tonight, talk a little bit about why we're here, what local public health is, what public health is in general, some of the services provided by the health district, and then we're going to also look for some interaction as far as what makes a healthy community. One thing I do want to stress, we want to try and make this very informal tonight. So as we're talking, if you have a question, comment, don't wait until the end. Ask it now. So let's try and make this informal. Let's try and make it fun tonight rather than just us up here giving statistics and stories about public health. So really try and work with us here tonight. And I want to turn it over to Deputy Commissioner Lewis right now.
Thank you.
Thank you.
Hi, everybody. Good evening. Thanks for taking time on this nice Wednesday evening to be with us here. So we're going to talk a little bit about why we're here. So last year, we received a small grant from the Aspen Institute, and we have created what we're calling Lead Public Health. And Lead Public Health is really a way for us to create demand and excitement around public health in the state of Connecticut. So what we've done is with our communications department, we created this little logo called Lead Public Health, where we're going around the state and helping people to understand what it is that public health does for them and how they benefit every day, maybe without even knowing it, many times without knowing it. So what on earth is public health? Well, the Institute of Medicine says that public health is what we do as a society to assure the conditions in which people can be healthy. And that's a mouthful, but I think that it'll become very clear as we go through the evening what exactly it is that we do in public health and how we do assure the conditions in which you can be healthy. We'll talk more about that later, but when you take the tap from the faucet, you know that water is clean and safe to drink. When you go into a hospital, you know that it's been licensed by the Department of Public Health, and the nurse and the doctor that see you also have licenses from the Department of Public Health. You know the restaurant that you go to eat in has been inspected by your local sanitarian. And the septic system that you have and the well that you have has also been looked at by your sanitarian. So those are some of the ways that public health exists and does the work that you don't even maybe know that it's doing. Right, good plug, okay. So public health, Lead Public Health is what we're doing, like I said, around the state to try and create demand for public health. It's also an opportunity to start a dialogue and create a vision for what is a robust public health system look like in the state of Connecticut, and an equitable public health system. Shane is going to talk more about what the local public health system is, and I'm going to talk a little bit more generally about some of the public health services that exist. The circle on the right was created as a way to sort of explain what the 10 essential public health services are, and Shane's going to talk a little bit more about that. But just keep this in mind. So what we do in public health is that we assess, we try and assess for disease conditions, we try and monitor food outbreaks so we can stop them. Then we look at policy development. What are the healthy policies that we can create in public health that will keep you all safe and healthy in every community across the state? And then assurance. How do we assure that you get the services that you need, no matter where you live, no matter what your status is, no matter who you are, that you're going to get the same services in public health that every other resident of Connecticut gets. So those are sort of broadly what we're going to look at tonight. When we think about public health, what we like to do is we like to think upstream. So I'm just going to talk for a minute about that because this is one of my favorite things. I'm a former academic, can't help it. So I'm just going to talk a little bit about what it means when we think upstream in public health. So what we do in this country with our health care dollars is that if you think about a stream here, typically in health care we're downstream. We're pulling people out of that stream. We're saving people once they have a heart attack. We're doing emergency surgery. We're doing all of these heroic things to save people's lives. But that's downstream. It's very expensive. If we move a little bit further upstream before they get to that point, here we are we can get people, for example, taking the medication that they need, eating better so that they can control control their diabetes and do the right thing. So maybe they don't get to that point. So we've saved some money, right? If we go a little bit further upstream and we create healthy policies and healthy systems where people never fall into that river in the first place, we've done a great job. People stay healthier and they are healthier. So can anybody think of an example of what an upstream policy is in public health that has saved a lot of lives, prevented people from getting to that point way downstream? I can tell you one if you want me to. How about seatbelt laws? Did you think about that? The click it or ticket signs, that's one of my favorites. So with public health, we recognize the issues that are happening with traffic accidents. Through our epidemiological studies, we were able to determine that car accidents were causing a lot of deaths. And through technological change in seatbelt laws and so on, we're able to save a whole lot of lives. So that's a policy example. Another one might be smoking laws. We have very strict smoking laws now in the state because of public health. We recognize that smoking is bad for us. We need to do something to change policies and systems so people can stay healthy. Is this making sense? Any questions? We're all set? Okay. Oh, thank you. So here's, again, the definitions of public health. So I'm going to ask Shane to talk a little bit about the first definition.
Thanks. And the other thing I wanted to mention, when you looked at the seatbelt laws and tobacco laws, this is what we're all so looking for right now is childhood obesity. We know that the smoking in the seatbelt took time. It was generational before we started seeing changes and improvements in the condition. That's really what we're looking for obesity now. We're doing some of the policies of removing soda machines from schools, the lunch menus at some of the schools, trying it that way. But we know this is going to be a generational thing, but we're trying to change the trend of childhood obesity, and we're using a lot of the seatbelt and tobacco laws and just trial and errors with that to help with the childhood obesity. So if you look up public health definition of what is public health, just on the first page of Google, you're going to see about 12 different definitions of what public health is. I think every public health practitioner has their favorite. Mine is the top one, a little complicated, but we're looking at the science and art of preventing disease, prolonging life, promoting health through organized efforts. And we're trying to inform societies, organizations, the public, private individual. So I always liked that definition because of the fact that it incorporated everybody. And that's what public health is to me, is population-based. One of the questions we get a lot is we get somebody calling with an individual health question. And we try to explain to them that public health is not, we're not a doctor. We're not there to take care of that disease. We will always refer them to a doctor, but we're trying to also explain to them at that point that we're population-based health. So I just wanted to throw that in there as far as the definition. That definition came from C.E. Winslow. He was a bacteriologist from Massachusetts who was also the first head of the Yale Public School of Health. So that was always my favorite, but I know you have your own favorite.
And my favorite is public health is all the things that we do as a society to assure the conditions in which people can be healthy. So again, it's making those upstream choices easy ones. So when you're in the store and the first thing you see is a lot of junk food, that's not a healthy default, right? That's not a system that really supports good health, good public health. So all the things we do as a society to assure the conditions in which people can be healthy. So I just want to talk for a minute. Shane and I were so much on the same page this morning that we both pulled these up at the same time and shared them with each other. It's like, oh. So the things that you don't think about, when we ask people, when I used to ask my students, for example, what is it that has prolonged life in this country? Why is it people are living so much longer than they used to? People think it's this extraordinary medical care that we have. It's antibiotics. It's a whole lot of other things. You know, we can do these emergency surgeries and fix people's hearts like we couldn't before. Those are important. That is not what has improved overall longevity. It is not why people live longer than they used to. It's because in the early 1900s, it's because we had good sanitation and clean water. So the great public health successes that we've had are because of vaccinations. Because of vaccinations, we have been able to eradicate polio from the face of the earth. We have been able to eradicate smallpox from the face of the earth. Polio was gone for a long time. It's coming back because of immunization rates going down. But there are no smallpox in people right now because of very aggressive vaccination campaigns that occurred. And in 1980, the World Health Organization said smallpox has now been eradicated. That's because of public health. All of the vaccine-preventable diseases that we can now eliminate, like measles and polio, we don't see those very often anymore because of very effective vaccinations. Motor vehicle safety, I just talked to you a minute ago about seatbelt laws. Amazing, right? That's a pretty straightforward thing. We don't even think about it now. We put on our seatbelt. That wasn't always the case. Safer workplaces. I don't know if any of you have been to the Mattituck Museum in Waterbury, where they talk about that was Brass City at one time, where they made all of the brass. There were many, many deaths related to the brass industry in Waterbury at one time. Those have really been eliminated. We don't see that kind of workplace fatality and mortality any longer. Control of infectious diseases, a lot of that is because of vaccinations and because we know what's going on now. We can track diseases. One of the earliest examples of that is Dr. John Snow in London, on the Broad Street station in London. He recognized around Broad Street that there were a lot of people getting cholera. So what he did is he looked at the people who were getting cholera and realized, you know what, all these people are going to the same well on Broad Street, using the pump to get their water. What he did is he took the handle off the pump, and the cholera rates dropped. So it's amazing how that's an example of epidemiology, which is the science of public health, really being used by a physician who recognized that cholera was such a big problem. So that's another example. Decline in deaths from coronary heart disease and stroke. We've come a long way in reducing that. People eat better. They understand about cholesterol, those kind of things. Exercise. Safer and healthier foods. We know the kinds of foods that are good for us and not so good for us. I don't know how many of you, your mothers used to fry the eggs in the bacon fat for breakfast, those kind of things. So we know now the kind of food that we need to pay attention to, and then maybe it's not so healthy for us. Healthier mothers and babies. One of the great advances in this regard is that women now take folic acid in pregnancy because we recognize that was a deficiency and was causing some of the birth defects and poor outcomes that occurred. So that's a very simple thing. Another is family planning. We know that people who have access to family planning services typically have better outcomes. Fluoridation of drinking water. This is really important. Our oral health program with the Department of Public Health works very hard with our drinking water section to look at fluoridation in water. This has been a great advancement and has really helped to decrease the number of dental caries or cavities that people get. And recognition of tobacco use as a health hazard. All the old movies, everybody was smoking. We don't see that so much anymore because we recognize what tobacco does and how harmful it is. We have a lot of no smoking policies now across the state and across the country. So there's a lot of advances that maybe we don't think about that are really because of public health. Does anybody have anything they want to add to this or a question about it? Any of those? Shane, you want to say something?
I think one of the interesting things, if we look at that list for the 20th century, when we look at the 1800s, when public health in the United States kind of formed, a lot of it had to do with the Public Health Service, which is actually a uniform branch. And they were formed because of the merchant marine coming from other countries before they would come into our country. So 1800, a lot of public health had to do with who was coming in, especially in a trade route, but then it also started with sanitation. I mean, the days of throwing this sewage out the window into a river. So 1800s, you looked at sewage, you also looked at almost like quarantine. 1900, it's all of those items, a lot of it. I mean, the word safe for workplace in the early part of the 1900s was huge. I mean, if anybody read Upton Sinclair, The Jungle, that was really a true public health book talking about it. And we looked at a lot of infectious diseases. As we're getting into the early part of the 2000s, it's more chronic disease. So as we raised the age, I think the life expectancy went up about 60% during the 1900s. So as we're getting into this next phase, we're looking at more chronic diseases. And that's one of the nice things about public health is it's always evolving. So what might have been the standard 50 years ago isn't necessarily going to be what we're working on today. So that was my ideas. And the big one for 2000s, in 2001, CDC made a new list, the 10 greatest achievements between 2000 and 2010, and the biggest one there was emergency preparedness. Before the events of September 11th, public health was not a big player when it came to emergency preparedness. And it wasn't even necessarily September 11th that put public health into that world, but it was the anthrax mailings afterwards. So as that, if you remember, the anthrax mailings went out, and as we started to look at how are we going to medicate people who might have been potentially exposed, when you looked at a lot of the traditional emergency preparedness plan, there was no factor for that. Public health, we know how to put pills into people. We know how to give vaccination. We've been doing flu shots for years, so it's just natural to get us involved at that point. And so as we look at the early part of this century, that's probably the greatest achievement over the past 10 years with our involvement from emergency preparedness.
Go ahead, Leslie.
One thing when I look at the list, I've never noticed this before, but when I look at the list, at least that one and some of the things you spoke of, it really speaks to the determination and perseverance of public health, because most of them were, and some of them still are, controversial issues. And the policy was changed, society did accept it, and we've seen successes.
And I just want to take a moment to introduce, I want to thank Leslie Balch from the Quinnipiac Valley Health District. She's Director of Health down there. I've learned a lot from Leslie during my career. She actually served as interim health director of the first health department I worked at about a few years ago.
Never noticed that before until tonight.
Yeah, so I just want to thank Leslie and her staff for coming, so thanks.
I agree. Thanks for being here. That's a great point that you made about emergency preparedness. So after September 11th, and probably even before that, public health became one of the most important partners in emergency preparedness. We just recently, at the Department of Public Health, completed a statewide, what we call a strategic national stockpile exercise, where we delivered pretend medicines, placebos, to 74 sites across the state. It started out with a call to the CDC saying we have an emergency, this is an exercise, we have an emergency, we need these supplies. The CDC from their warehouse, and we don't know where that is, distributed the supplies to a warehouse in Connecticut. We had really scores of volunteers there from the National Guard, the state police, Department of Public Health, local health directors, and so on, who worked on this exercise and was able to, within 24 hours, distribute these placebo medications to 71 sites across the state. It was a very impressive exercise. The CDC said that scale of an exercise hadn't been done in the contiguous U.S. in the past. So that's one example. For example. Okay, so we'll move on. And this is Shane.
Thanks. The other thing about that strategic national stockpile that was just mentioned, on September 11th, when all the air traffic was shut down, when there was only military flights that were allowed to fly, the one exception was the planes associated with the strategic national stockpile. That's how important of an asset this is to the country. So they were still allowed to fly assets from their secret warehouse to New York City at that point. So in Connecticut,
I'll start with the rest of the country first. Most of the country, outside of New England and Jersey, public health is done on a county-wide basis. Not really the structure that we have in New England, and New Jersey's just off on their own. So in Connecticut, we have either health departments, which typically are cities and towns will have their own health department, or towns get together to share health services and make a district. And what happened here was in 2011, on July 1st, Plainville and Southington merged health department and became the Plainville-Southington Health District. One of the advantages of the district, there's many advantages, our staff increased. So in Plainville, and I'm going to take a moment to introduce our staff here, we had Marco Palmieri, who was a sanitarian up there with a part-time health director. Marco's now our senior sanitarian here. So we were able to bring Marco together with our sanitarians. We have Scott Cook. Scott worked in Southington before. Thanks, Scott. We also have Kate Cupstas back in the back there. She worked in Southington before. And we also have Leanna Gleicher, our administrative assistant. Probably, and I gotta be honest, out of everybody's jobs that changed during the merger, was Leanna's, because Leanna had to become really, QuickBooks had to become a new obsession for her. Because as a district, what happened is the towns put in their agreed upon amount, and then it's up to the districts to operate throughout the year based on that budget, along with funds that we get from either fees or grants, both either local grants, state or federal grants. The great thing about the district is we're able to increase our staff. So rather than having a staff of one in Plainville before, we now have 4 sanitarian and a full-time health director that could work up there. Same thing in Southington, we're able to have a bigger staff here to be able to quickly respond to something. So that's helped out. Financially, it's made us eligible for other state grants, so we're able to increase our budget that way. Before, because of some thresholds with the state, whether it be population of 50,000 people, we weren't eligible for a certain state grant. With those grants, we're able to now hire 2 part-time emergency preparedness coordinators that we wouldn't have got before if they were still operating as 2 individual towns. So we're able to increase our staff, we're able to increase our services. So as we have a bigger staff, they're able to put more services on. I'll give you an example. In the past couple of years, they've done a great job. They came to me, said that they wanted to do some education for restaurant owners. So they worked very hard on setting up training. Restaurant owners every year now come in, and workers come in. The staff puts on about a 2-hour training, refreshes them on the public health code, common violations they might see during the inspection, and it's a non-threatening way to have a nice discussion, rather than the only time that they see us is when we show up at a restaurant and say, hey, we're here to inspect you, and it's that kind of everybody's a little bit more on guard. By having it here in Plainville, we have, it's a nice discussion, we get a little bit more out of it, and we've definitely seen an improvement in our relation with the restaurants. We've also been able to do certain programs when it comes to more health education. The sanitarian, when you're inspecting restaurants every day or looking at septics every day, it's a tough job. Sometimes you need a break from that. So again, last year they came to me and they wanted to be able to take on some new projects now that we're a little bit larger. So everybody had a project that they wanted to take, whether it be Lyme disease or West Nile virus or sun safety, as far as protecting yourself in the sun. So it gave them a chance to work on new projects that they probably couldn't have had if we still remained 2 separate departments. And so again, you have departments and districts in the state, and I think right now there's a total of 74 health departments or health districts. There's also a group of part-time health department. So a lot of the small towns, they hire a part-time director of health, maybe a part-time sanitarian. So in what the state's tried to do over the years is trying to encourage those types of towns to join a district so that the residents there could get full-time comprehensive health services. The other note is we formed 2011. We're still the newest district out there. Certain towns have talked about forming some districts or joining them, but we're still the newest district. So as far as what public health does, this is a pretty standard graphic which shows the public health in the middle, and it tries to describe some of the agencies we deal with, but honestly it doesn't come close to showing all of our relationships. Just as an example, we work very closely with fire departments. A lot of times that's going to be on emergency preparedness, but it could also be on restaurants. We work closely with the fire marshal's office as we're inspecting or they're inspecting to talk about issues that we have. And so we have a close relationship with fire department. Police department's the same way. We work, besides the normal day-to-day stuff, we do a lot of planning, especially when it comes to suspicious powders. You always hear about like the white powder scare. Somebody finds a powder on the ground and they're worried about it, and rightfully so, worried about being anthrax. As we respond to that, it's a close response with police, fire, health. A couple of the other agencies, we work closely in both of our towns with youth services. So we have Southington Youth Services, we have STEPS, which is Southington Townwide Effort to Promote Success, and then we also have the Plainville Coalition for Positive Development with Children. We sit on both those boards and work very closely to promote events, and that's what public health is. So as these organizations are looking to put on an event maybe around legalizing marijuana is one that they've talked about in the past year as far as the laws associated with that, or decriminalizing it. They've come to us so that we can put out some health data. So when they have this event for children and for parents, we can supply them with the public health data associated with it. So we're very lucky in these towns that we have two strong youth services groups. We work closely with the elected officials. We have a few here tonight, and thank you all for coming. But it also helps us when it comes time when we're looking at different policies, or we're hoping to promote the health district, or even it's important for the elected officials to know what we do. So when they have a resident call to ask a question about this is happening in my neighborhood, who could I call to either find out more information or maybe there's a complaint, the elected officials know that the duty of the health department might be, if there's a nuisance complaint, the health department could go out there and cite a property owner. Hospitals in Southington, we're lucky to have Bradley Hospital. We work closely with them, especially with the ER department. They sit on our EMS committee where we look at the EMS calls on a monthly basis, but they also look to do more. Recently, the Hospital of Central Connecticut completed their community needs assessment. This was where they looked at all of the towns in their catchment area, interviewed residents, saw what the needs were of the community, and they're starting to put that into a community health improvement plan. As they looked to do this, they invited the health district to sit on the panels that were helping to form both the assessment and the improvement plan. And again, there's really not a group up there. Recreation we work closely with, the senior centers we work very closely with, and we really are involved in everything. Because health, it's there. I mean, it affects everybody. And when we're looking at who does public health, I would say all of these organizations in some way do public health, but the public does too. A big example of that was probably 1999, you start having West Nile virus. You saw some cases pop up around the Bronx Zoo down in New York, started some cases up here in Connecticut, and we started looking at how are we going to track like West Nile virus. It came up with and Leslie will remember this, and Sanitarians were, if people saw a dead crow, they were supposed to call the health department. I'll tell you now, in 2000, during the summer, good luck trying to get through, because that's all we were getting. We were getting dead crow calls constantly. But it was a way to involve the public in it and really let them know we were taking the crows, we were picking them up, taking them to the state lab, seeing if they were positive for West Nile virus. And it was very important at that time. West Nile virus hadn't been seen in the United States. It hadn't been seen in our climate. So we needed to know at that point, is this something that was going to survive from year to year, or was that first cold frost, that first winter, going to eliminate it? So during that time, the public was instrumental in helping us realize it's here to stay. So we're going to have to change our approach and make sure we start telling people to, remove stagnant water from their property, wear long sleeves, or spray on something with DEET to help. So the public really is involved at that point. And can you think of any other agencies or groups that would be involved?
No, I think all of them are mentioned.
The other one I want to mention was volunteers. So we're very lucky in Southington to have the CERT team, Community Emergency Response Team, and they're operated under the fire department. They do a great job, and we're lucky because they've been getting very involved in Plainville events. Recently, we had, Plainville has a big event, Wings and Wheels, great show. They have antique car show. They have the planes up there. Great food, I'll tell you. Not the healthiest, but still great food. Okay? And we had the CERT team from Southington go up there and help out with traffic control. So I got to give them a big hand here. The volunteer, we couldn't do without it. They also volunteer every year at our flu clinics. And whether it's, even though they're stationed in Southington, if the clinic's in Plainville, they go to Plainville all hours, whether it be early morning, late at night. They're a great asset for us to have. I just want to make sure I don't leave anybody out.
The only other thing that occurs to me is we haven't talked about our federal partners, because we can't do public health. Just like we can't do it alone without the locals, the federal government also needs the states to do public health. So we have federal partners, the Centers for Disease Control and Prevention, the Federal Drug Enforcement, all of these federal agencies that really help us, Department of Homeland Security. There are a lot of federal agencies that also are involved in public health, the Health and Human Services agencies at the federal level. I just want to acknowledge that there's really 3 levels of government public health, but there are all these partners in the community that also we can't do public health without them. So just want to acknowledge that.
Definitely. It's just yesterday, the FDA was here in town in Plainville doing an inspection with Marco. They're doing a big study, and they wanted to check out certain types of establishments. We happen to have one in Plainville, one in Southington, so the FDA was here yesterday, and I believe they're coming back tomorrow too. So again, they're a very important partner. So when you look at all these things that we partner with people on, we have to start looking at what services that we provide also. And it's kind of the ones people always think about the health department is going to be, they're the ones who go inspect the restaurants. And we certainly do. We have, I believe, about 462 food service establishments between the 2 towns that get inspected anywhere from 1 to 4 times a year, if not more if they need a re-inspection. So we're very busy when it comes to the restaurant inspection. The other one that you might think of is if anybody's on a septic system. We would have gone out there at the time it was installed. We would have approved the plan, looked at the septic system, or if there's a problem with it, we go back. But that's such a small part of really what we do and what the sanitarians do. We do daycare. So the daycare is licensed in I'll let the Deputy Commissioner tell me the name of the new agency up at the state. They've always been licensed by the state, but they get inspected on both the local and state level. So we have a certain code that we're looking at when we go there, and the state also has that code. And it's what the office
Yeah,
of...
so the daycare, from the state perspective, our daycare licensing program just transferred July 1st to the Office of Early Childhood, but in those inspections, they're looking at things like ratio of children to adults, and safety issues. Is a playground safe? Is it those kind of issues? Really, that's what the state is looking at.
And we're looking at a little bit more of the environmental, so we're looking at potential lead paint issues. We're looking at the food inside there, the water, a lot of the playground stuff falls back to us. So it's nice to work with the state on that for the inspections. It's always been a great system that we've had. We also look at bathing water, so any large ponds or river, we don't really have the rivers here, but anywhere where people are swimming, we go and take water samples for on a weekly basis during the summer, make sure that the coliform levels are where they should be. Inspections, besides the daycares, we also do housing inspections. That keeps us very busy, especially winter time when we get a lot of the no heat complaints. They're constantly running out to look at the properties, then calling landlords and property owners to try and get it fixed in a very timely manner so that nobody's going to bed cold. We also do public pools. So I think we have about, in the district, 17 public pools, a little bit more because we have a water park also. So we go and look at these public pools. Summertime, they're busy with that. They're going there once every couple weeks. And then for any of the indoor pools, some of the hotels and maybe school, we look at throughout the year. One big thing we do is disease follow-up. In Connecticut, there's a list of probably about, I'm going to say it's about 70 diseases that if you get the disease, your doctor has to, or lab has to report it to both the state health department and the local health department. A lot of the diseases we don't follow up on, but a lot of the communicable or the foodborne diseases, we follow up to interview the person, find out where they got it from, and hopefully prevent spread of it. Especially what we do is we start talking to them about what do you do for a living. If we find out that they work in a daycare, if they work in a restaurant, we're going to prevent that person from working in that industry until they've been cleared to return to work. And like I said, Leanne is the one who gets to open those every day, and we probably easily get close to 10 reports a day. So we're very busy with the disease reporting. Health education, I mentioned a little bit before. The sanitarians do a great job of, one, putting on training courses, and all of our training courses are free. So we're trying to really let industry, whether it be the restaurant or if we do training for public pools or daycare, all of it's for free. We're trying to let them know that we're a resource to come to and ask questions rather than just seeing that one time a year inspection. We'd rather them know the information up front so that they're using that information every single day rather than the 1 to 4 times a year that we're inside there. So we're really trying to step that up recently. Outbreak investigations, we'll get a little bit more into how local and state work together on outbreak investigations, but this could be anything from a foodborne outbreak. We get a call, we start investigating to see if there's a bigger outbreak happening. It could be disease, maybe a gastrointestinal issue at a nursing home. It could be something at a school. So we're very involved into any kind of outbreak. One, we want to try and stop it as quickly as possible, and we also want to see, to learn from it, to use this for education for the rest of the industry. So if we find out outbreak was associated with a way somebody was preparing their food at a certain restaurant, we could use that at our next training class to say, you know what, these things actually do happen. This is what caused the outbreak. Make sure you don't do it that way in the future. Emergency preparedness, I think we've talked a lot about. we're very involved in writing both, updating the town's plans and our own local plan. So the health district has a response plan that covers a lot of emergencies, anything from a water source has been contaminated with E. coli, and we have information about how to boil water that we get out to the resident. We also have a communication system to either communicate by fax or by phone to be able to get messages out quickly. We also have an emergency preparedness plan that covers whether it be pandemic flu or other diseases. It could be a bioterrorist event, so we have plans for smallpox, anthrax. So we're very involved in emergency preparedness and take part in the drills. Besides the stockpile drill that was mentioned, on late June, the state held a big hurricane drill where all 169 towns in both tribal nations participated in response to a hurricane. This was a unique experience. Rather than operating a Plainville Emergency Operations Center and a Southington Emergency Operations Center, we actually did a joint EOC that day. So it's the first time the two towns worked together under the same roof to see how we could respond together, and it was a really good example for us. Some of the other services, flu shots. Every year we do probably about 700 to 800 flu shots and pneumonia shots. We do usually probably about 6 clinics, 3 in Southington, 3 in Plainville, and that business is kind of slowing down a little bit. The pharmacies, grocery stores, the pharmacies inside there have been able to do it a little bit more efficiently lately because of the fact they have a pharmacist and nurse there all day long. Rather than having to come wait 10 minutes at one of our clinics, they could go there and they could usually get a coupon book that lets them go buy 50 cents off something else in the store at the same time. So we're still doing it. It's still an important part of what we do. But again, we know that there is competition. What we're trying to do now is really just promote the flu shot, remind people it's an important thing to get, let them know all the resources are out there to get them. So they don't necessarily have to come to us. We're just happy if they go get it somewhere. So we're really trying to promote that because we've had a couple bad flu seasons lately. This year was a bad one that had a couple different waves too. It went much longer into the calendar year than it typically does. At least, I don't know if that is Quinnipiac's experience too, but that's what we saw locally. We work closely with the schools to monitor absentee rate. One of the best ways to know if what's going on in the community is to talk to the superintendents. If the kids aren't going to school, there's probably something happening in there. And this was really evident during the 2009 H1N1, where we were able to see when it was really hitting the community and when it was getting out just by monitoring daily absentee rates. The one thing I'll say from experience is you don't get too excited about one day's data. Because if you look at 2009, what happened, the first wave of the H1N1 hit in May and carried into June. And one day where I worked at the time, we saw absentee rates of 50, 60% that day. And we're like, oh my God, what are we going to do? It's here. It was senior skip day. So all the kids were like compounds or the beach, okay, and here I'm stressing for a while going, oh my God, we're going to have to close schools, everything else. It just, so you have to use data effectively. And really, so that's kind of what we do locally. We're always looking to add new services, and as public health changes, again, 1999, I would have told you the next big thing in public health that we're going to be working on for the rest of our careers is West Nile virus. And honestly, now it's a disease that's out there. We remind people about it. We constantly remind people about mosquitoes, but it's nothing like it was when it first happened. And that's one of the nice things about public health is we don't know what that next step is going to be. So I know what we kind of want to do now is talk about, so we have all these services, the state has all these services, and we want to talk about how we interact, because we can't do it alone. I mean, a great staff, but we're a staff of 5. So, I mean, if something big really happens, we need help, or if there's something outside of our normal comfort level, we work closely with the state to figure this out.
Yeah, so we can't do public health alone. So what we rely on is the local health departments and districts to tell us what's going on in their community, so we can identify. If you think about a physician or a physician's office, they have a certain population of patients that they see. For the State Department of Public Health, our patient is the state of Connecticut. So we're monitoring constantly what's going on in the state in various ways, with the data that we collect, with what we know about birth and death, and so on. So we're always looking at the state as being our patient. So some of the ways that we work with the locals is they might identify, for example, some sort of disease outbreak, but guess what? Diseases don't know that they're supposed to stay within the Plainville-Southington town lines, right? So they have this habit of going elsewhere. So we have to be prepared at the state level to assist perhaps several districts and towns if there is a disease outbreak. One of the interesting things that I discovered, I've been now for 2 years in this job, is that we did a sort of a case study at a semi-annual meeting that the commissioner holds for the local directors of health. And within this exercise that our state epidemiologist did around if there was some terrible disease, like, I don't know if you've heard of the Middle East Respiratory Syndrome virus, MERS-CoV virus that's in the Middle East. Well, there have been a couple of cases transported into the U.S. We don't have the disease here yet. It's not being transmitted easily person to person, but it exists. And that possibility that it could become worse is there. So we did an exercise about what would be the responsibility of the local health departments and districts, and what would be the responsibility of the state, and what can we rely on from the Centers for Disease Control and Prevention, or the CDC. And what we realized is that if, for example, people were flying, say, from Saudi Arabia, where the disease is more problematic, through Toronto into Hartford, there are 3 local health departments that have responsibility at the airport. Which one of those health departments is going to take responsibility and manage that disease? So these are some of the issues that we have to figure out with the state and with the local health departments. We just simply can't do it alone. So many times we've been on calls with you all when there's a white powder incident. Those come to the lab, the state laboratory, for example. When there's a big foodborne outbreak, our state epidemiologist, the epidemiologist on his staff work together to help to identify where the foodborne outbreak came from, whether it was a restaurant or a wedding or whatever, however it happened. So there are many ways that we work together. And like I said, we just can't do it alone.
I can assure you that Plainville Airport, okay, we're not looking at any international flights anytime soon, right? So,
Sometimes they get through.
yeah, but I just want everybody to rest comfort with that one right there. And really, I mean, one of the great things you talk about, the foodborne outbreak. So we have a reporting system that really has improved how we look at foodborne outbreaks in the state. What we do now is if we get a call, we have to report that to the state health department. We fill out a form once we talk to the person, send it up to the state. Rather than it just happening in Plainville-Southington, they can see, is there also similar type 1 happening in the southwestern part of the state? Then they can compare that to national data. Connecticut's always been one of the pioneers when it came to the FoodNet system. FoodNet looks at these reports from, I think they're probably up to like 20 states right now that they look at data, and that's how they're starting to see a lot of the recalls you see, the big national recall, are based on the fact that you had an outbreak or you had one case at the local level that was connected to another case locally or regionally, and you see it build up that way. So this FoodNet program really has changed the reporting system, and that's why you do see a little, well, many reasons, but you see a little uptick in the food recalls over the past couple of years, and that's a lot of it's going to be based on reporting. One of the things I also want to just talk about, one of the bigger grants that we see on the local level is our block grant, and I'll talk a little bit about how the state and local health departments work together on this. The block grant, there's a lot of different directions you could go with it. We've chosen the direction of how to promote long-term health, really how to make a sustainable change in the environment to increase health long-term. And I was hoping he could be here tonight. The individual from DPH, Eugene Nickel, actually lives in Southington. He's been great. We've been talking past couple of years, one of the things that both Plainville and Southington needed were more bike racks and promoting biking. We have some nice roads here that people could get out. There's no place to park a bike safely, and there's no connection between the two. So 2 years ago, we started working together, and Eugene was great about this. He was giving me ideas. And we've put, over the past 2 years, we've probably put 8 to 10 bike racks in both towns. We have them, the greatest success we've had is at the Plainville Senior Center. So we put one at the Plainville Senior Center, and almost any day you drive by there, there's going to be a bike parked into there or attached to it. What they've also done now is they've done bike tours. So people are riding their bikes there, and then they're going for, they call it like bikes and bagels. So they ride out to the local bagel shop, get some food, bike back. These are people who otherwise would have just driven there in the past. Here we're giving them a chance to promote bike safety. The senior center has done a great job. They put on, every year they're putting on like a bike safety course. They bring in a person, beginning of summer, that person checks the bike, the helmets, the tires and all that, and then they go out for a nice ride, and they're hoping throughout the nice weather people do this. And again, when we first put it up there, a lot of people were wondering how much use this would get. It gets more use than the other probably 8 we've put in both towns combined. So that's really one of our greater successes. We have them on the trails here in Southington. We have one when this building was renovated. We put one down in that lower lot. We put one over at Town Hall. Plainville has 2 coming in the next week from this grant, and I think one's going up at Town Hall, and I forgot where they're putting the other one. But we're trying to create a whole environment where, rather than driving everywhere, somebody could ride their bike downtown or to the senior center, and just trying to get that change. And I just really want to thank Eugene for that, because he was the one pushing it, and I think his local knowledge of the area helped as we started to talk. The other nice one we had was in Southington. There was an old park that kind of was abandoned for a few years, J.C. Park. It hadn't really been used. You could see the remnants of an old basketball court just from the old cement. And last year, Parks and Recreation Department came to me and talked about how they wanted to knock down all the brush and make a wiffle ball field there. And where it's situated, there's a lot of communities around it, and it's pretty flat. And they wanted to know if I could find them a bike rack to put there, because as they're trying to encourage not just kids, but trust me, guys my age, if you say there's a new wiffle ball field, okay, we're going to go play. And so trying to encourage kids, adults, to ride a bike over and then have some fun, play a wiffle ball game, at least something more than typically what they would do at night. So we've had some great successes with that. I'll just keep going. Another great program up there is the food program. So the food program, they work with us to certify new sanitarian. Public health, we have a very aging work staff in public health. We're really trying to promote it to the next generation, hoping that they see the benefits of public health. We have a couple here tonight, but the food program is great because they're able to help put on training for students graduating in public health, get them certified, and then they also work with us throughout the year to put on training courses to keep people certified, latest education, latest recall information. So they're probably the ones that I would say we work most closely with. Do you have any comments about it?
Yeah, they're busy. The food protection program at DPH is a very busy program, trying to certify new sanitarian. So I wonder if we could just ask if people have questions.
Okay, sure.
So anybody, yes? Please use the microphone.
I just wondered if there was some indication on these bike racks of where they come from, compliments of DPH. Do people know about it? My head is spinning from all the things you do, and I just wonder how well you're letting, I know this is part of it, letting people know what you're responsible for.
So I can tell you that the grant actually is a federal grant. It's the Public Health and Health Services block grant that you're referring to.
Right.
Yeah. So it's a federal grant that we get, and we're allowed to disperse it in certain ways. So it has to go through some steps. But the block grant is wonderful because we have some flexibility in how it's used. So each local health department that receives funds will do things differently. So.
And as far as promotion of it, Plainville Senior Center did a great job doing their initial bites and bagels. Everybody looked, it said compliments of the Plainville-Southington Health District provided with grants provided by the State Health Department. In Southington, one of the documents produced recently was Activate Southington, which is a group of, I sit on it, the YMCA sits on it, other town official businesses trying to promote the healthy opportunities in town. They put out a decent-sized booklet showing, ski areas, all the parks, what you could do at it. On the front page of that, there's a picture of the bike rack, and it talked about compliment Plainville-Southington Health District with funds provided by the State Department of Public Health. So we don't have it on every single one, but we're hoping to. Yeah, we got to do a little bit better job sometimes, and that's on me of promoting ourselves, but we're just happy we get the things out there. Hopefully it gets used, and then we look at it that way. But so we've had some publicity, but probably not as much as we could have gotten from it. Yeah.
Anybody else have questions? Should I ask you a question? How about this? What's that? Go ahead.
First of all, thank you very much for your presentation. It's excellent. Lots of information that many of us know but need to hear again and again. And I think that's what you're doing when you go out to provide information to our diners and to the owners of restaurants, also food daycares and so forth. Refresher courses are always good to hear. If you're good in the presentation that you make, you always pick up something new. So thank you very much for that. Secondly, in the issue of getting your information out, just a little, I know how everybody's overworked and you have a lot to do, but you have a lot of good publications that go to the home directly. If you could just do a did you know, and just provide, you could do a whole years by just putting it in, letting your newspapers put it in wherever you want. They always are looking for fillers. I think it's a great thing to be able to reinforce what you do according to the season. That you're out there, this is what's happening. Secondly, this year I put in a bill in the General Assembly because I'm very, very, very involved with clean water funds, clean water, aging population. You talk about aging sewer lines and all the other ways in which to get water to your home. Decaying, and we need to be able to make sure that that's done firsthand. But we're also very much involved in what goes into the water system. And for years, people have been disposing of their prescription drugs through the toilet or through some other means, and not only is it dangerous, it's polluting our facilities. So in the town of Plainville, we have a prescription drop-off box. We have one also in Farmington, which is in this area of Farmington. I believe there's like 60 or 70 more in the state. I'm not too sure what Southington does. I know periodically people have these programs that you come, and we encourage that, absolutely. But you never know when you have to go in a home for an elderly person and a not so elderly person. You come across all these prescriptions. What do you do with it? It never comes directly upon the time that you're going to have this program. So have a place like the police department. So the bill does allow for some funding if you don't have it in the police department, or someone that's open 24 hours that for a little time only will be able to provide that for you, and an application can be made. I just wish to let you know that so that people can drop off. at the police stations. And it has, and I've been checking on Plainville's periodically, and they've been doing a great job. Over the whole situation, I've used it myself several times. You don't have to wait till you accumulate 100 pills, but you can go and get it done when you need to do that. So this is important. We also had flooding situations in the town of Plainville and other areas where we've used the department. We can't thank Marco enough for all that he has done. And we hope that we cleaned up a few of those areas that are flooding. Margaret had a home there. She's moved out, and we've been able to use a fund that we have set up so that people, if they were receiving FEMA dollars, could also come and secure funds from the state to sell their homes. And it's open to everyone. We've been able to do, how many, Margaret? We have 10 in Plainville, and Bristol's done and used several places along the Quabbin River. We need to get that information now. So thank you for all that you do, the continuation of what you do, and thank you for having this forum. It is very informative. Thank you. I wouldn't expect anything less since your chair is a Plainville resident.
Thank you for that. Anybody else have questions you'd like to ask? So I'm going to...
Just for clarification, we do have a Dropbox, right?
We do, yes, we do, absolutely. We have a Dropbox at the police station here in Southington. We've used it many times, my husband and I. Yeah. So, yes. Let me ask you a question. What would you think of as a healthy community? What does a healthy community look like to you? You're thinking about public health. What does it look like to you? Anybody?
Lots of preventative programs.
Preventive programs? Okay. If you're thinking way upstream, what would a healthy community look like? How about bike racks? But what do you need in order to get your bike to the bike rack? Bicycle paths, maybe. Sidewalks. Things like that. What else would a healthy community look like? What would be involved in
The money to buy the bicycle.
the helmet? Good public health. What else? Anybody else? What if you had your ideal healthy community, what would it look like?
Access to healthy foods.
So you're thinking farmers markets, maybe community gardens to bring food to... Great.
Can I comment on that?
Yes.
So both towns have farmers markets. Both operate on Friday afternoons. I think Southington started up last weekend and Plainville started up 2 weekends ago. So they operate during the summer, throughout the summer into early fall, and both of them are great success. I mean, they've really taken off a lot more than I think we probably expected. This year, the Health District will have a table every other weekend at each farmer's market. We have 3 local residents who are going for their Master Gardener certification, and they need a project. Well, we worked on it. They're going to be at each farmer's market every other weekend talking to people about healthy recipes. So as somebody's buying that food, we have a booth where they could go to and get more information on how to prepare that in a healthy manner. So we're looking forward to that.
It might be interesting because some of the local chefs at the restaurants explain how to prepare some of these healthy foods. You see kale and things that, the foods that no one's ever seen before are on the vegetable stands. And it'd be fun to have, local restaurateurs who are involved in your whole system of health, give recipes and try to cook the things to food prep.
Absolutely. And that was not a plan at all. My second, perfect, thank you. The second thing we're working on right now is to take the registered dietitians who are going through the Master Gardener, and we're looking to do a program with a chef in each community right now, where we're able to talk to them about some foods that are in season at that point, and the chef's going to prepare a meal based on that food, and the dietitian will be able to talk the health benefit, the chef will be able to talk how it's prepared, and we're hoping to educate people, so thank you.
And if that would then put in some of our local papers, like the Observer and the stuff over there.
The Citizen.
If that would be the Citizen, yeah. So then if you could get those into the local papers, the Citizen. that I think would be really beneficial, because if people are at the farmer's market, that's fine, but they won't get the information if they're not.
Right, so we'll look to take whatever menus that are prepared by the chefs with the dietitian, and we'll look to promote that. As often as we put it on, we'll put something in there.
I do want to know how to cook kale.
Yeah. We also have a program, Chefs to School, where Plainville's taken some local chefs, put them in the school to help the kitchen staff learn how to prepare meals in a healthy manner. So. Any other questions? I know. He's going to yell at me.
I work in adult education in Southington, and I'd like to know how I can get some of this information to our civic students.
Let's talk after this meeting. I'll give you all my contact information, and whatever you need is yours.
So let me ask you one more question. How about, what is it that you could do yourselves to help create a healthy community, to contribute to public health in some way? Anybody has any ideas? What if you want bicycle paths? What might you be able to do in order to help some bicycle paths or sidewalks be created or built in your town or city? How about attending meetings for your local planning and zoning boards? How about writing a letter to the Hartford Courant or to your local paper? How about getting out there and doing something like this, attending meetings like this, encouraging your friends to do so? Did anybody have any questions about public health that you think were not answered tonight, or you're still not sure what public health is? Yes.
This may not be appropriate, but I was at a meeting last night, and a question came up, because I think in the Southington talks it may have been mentioned. We run the drive-in on Saturday nights, and the question came up, is it okay for people to smoke at an event like that, because you're open air, but yet it's offensive to the people in the car next to you or in that area? And I made a statement saying that it's a public assembly and that smoking is a public assembly. I'm probably wrong. I always do that. I talk like I know what I'm saying, but I don't really know.
Well, you sound good when you do it.
So I'm not sure if you know the answer to that.
I don't actually know the answer to that. I will say that there are some, for example, I know there are some colleges and universities now that are working to become smoke-free entirely. So in addition to no smoking inside buildings, which is the law in Connecticut for most buildings, I think the casinos are exempt and some smaller businesses, but for the most part, smoking is exempt. I mean, smoking is not allowed anywhere. And some colleges and universities are going further and saying that even outside of the buildings, you're not allowed to smoke. So I don't know what the local, it may be a local ordinance. Maybe you know, Shane, better. Oh, Leslie.
I just want to make a comment that there's a difference between a law and a policy, because all policies don't need to be laws. But you can have a policy for any property for which is under your control that does not have to be a law. The law in Connecticut is specific to indoor spaces. However, that doesn't mean that we can't make a policy for outdoor spaces, particularly when other people are exposed to it.
So Cheryl is the chairperson of the ordinance committee, so we can create an ordinance that this is all property.
And where do we start as law? Just go there.
Well, you know what, the hospital and any of the facilities that are owned by Harvard Healthcare, there is no smoking on the property.
Right.
And so, you know,
So Southington Care Center, there's not only can you not smoke at Southington Care Center, you cannot smoke on the property.
Exactly.
And so I think it's just a matter of us making a policy on the town council level. And then, of course, we need signage. So just to let folks know, and then of course,
I don't want to work the night that we posted.
And one of the things too, the hospitals a few years ago, so not just the hospital of Central Connecticut, but all, 31 acute care hospitals in the state, looked at doing the no smoking anywhere on their grounds. So the hospital, and it was a bigger, I think, pushback than what they expected. And so, but now they're all smoke-free, the campuses, so I think that it could be done. It kind of goes back to that earlier point where we just have to teach people. So whatever you need from me for information, just let me know.
Anybody else have questions? Questions about public health? Not one person asked how to enroll in health care. Very proud of you all. Thank you. It's not why we came here tonight. Healthcare is important, but what we think about in terms of public health is that we have this broad health system, of which healthcare is a part, and so is public health and all of the other things that go into creating those conditions in which people can be healthy and make healthy choices. So we're happy to answer questions. I don't know if you have anything else, Shane, that you wanted to add.
No, I just really want to thank everybody for taking some time out of their evening, come here, listen to public health. As you could tell, we could talk about it forever, so I appreciate you coming, learning, asking some questions. If you have questions after today, the contact information for both Deputy Commissioner Lewis and myself are up on the board, and certainly contact us, and we'll be happy to talk to you.
Thank you.